I'm Dr. Robinson. I'm Medical Director of Longevity Health and Wellness. And today I'm just speaking about wellness overall and how it affects the things that we do here in our practice. So obviously anyone here today is interested in vitality, longevity, and the pursuit of looking younger. So in order to accomplish that, it is important that we understand the controllable variables that contribute to chronic disease and aging. So one of the more modern models that explains a lot of chronic disease and the aging process is metaflammation, which means metabolic inflammation. Inflammaging is another term that's used, but basically inflammation drives every chronic disease that we suffer from has an inflammatory base. So everything that we're exposed to from the environment to our lifestyle choices contributes to the stress on our metabolic system, and it causes this metaflammation process. So smoking, drinking, starvation, excessive intake, inactivity, excessive exercise, obesity in general is all a contributor to this stress that really stresses our system. In this process, as I mentioned before, it affects really every organ system that we have in our bodies. So it affects our pancreas by causing increased insulin resistance and diabetes. It causes autoimmune disease, dementia, cognitive issues, thyroid disease. It suppresses natural hormone production, but also one of the biggest organ systems that it affects is our gut or GI system. These stressors really stress and damage our intestines. So you have tight junctions in your intestinal lining that become leaky because of chronic stress. Because of that, the bacteria and toxins in your intestines and inflammatory particles can actually leak into your bloodstream and causes endotoxemia, which can go to all of your organs, and it's really part of the metabolic model for heart disease and dementia and a lot of those constructs. Leaky gut syndrome is a byproduct of that, and pretty much almost any symptom you can think of could be related to leaky gut syndrome. Headaches, sinus issues, allergies, arthritis, irritable bowel issues, obviously. In the aesthetic world, it's really important for skin because acne, rosacea, all have a GI or gut preponderance. It can cause adrenal fatigue. It can also cause thyroid disease like Hashimoto's thyroiditis, hypothyroidism. This chronic inflammatory process damages the cells in our body. It makes our normal cells less active. So they become senescent cells or zombie cells, which are cells that replicate, but they really don't perform the normal function. So they accumulate, and over time, you have cells that are in place, but they're not doing what they're supposed to do. With the skin, the way this is manifested is with wrinkles, loss of collagen, skin laxity, loss of the structure of the face. So the zombie cells don't function as they should. So how do we combat this? What we need to do is to promote the overall healing process. So this overall healing process is a comprehensive wellness model where you use nutrition, you improve gut health, you recommend, in terms of dieting, fasting is very beneficial for promoting the regenerative process. You want to restore the natural rhythms, circadian rhythms, sleep patterns are important, but you also want to help the body to initiate its own natural regenerative process. So you can accomplish this with introduction of certain particles. They're called peptides. Peptides, well, recently I completed a peptide fellowship. So peptides are really powerful, naturally occurring tiny particles. There are 40 amino acids no more than 40 amino acids large, so they're really tiny, and they're naturally occurring. There are roughly 7,000 that exist, but each particular peptide serves a specific purpose. It becomes a biosignaler, so it briefly interacts with a cell and it activates DNA pathways. It turns them on or off to promote whatever action you want to promote. So these peptides can be very useful for a variety of treatments and preventive treatments for all different types of diseases. Specifically, it has applications in the weight loss world. Some peptides that people are very familiar with would be like HCG, Ozempic, which is from semaglutide, which is a peptide. Those are just examples, but there are thousands of others that have clinical applications that can be applied in the aesthetic model and in other models. What we're hoping to do over the rest of this year and into next year is incorporate these peptide particles into our practice models to improve efficacy, to promote the natural regenerative restorative process so people can have better outcomes. This whole concept is creating a new type of treatment called cynotherapeutics, where basically you're using these types of molecules to affect how we age. And obviously it's easier to prevent the process than to cause you to return back to a more youthful state. So being proactive and attacking things before you suffer from chronic disease and those types of ailments is important. So, well, we really offer a variety of things. So, I mean, like I mentioned, I mean, like for example, our weight loss program, we recommend intermittent fasting. We use peptides like semaglutide, but we pair them with other peptides to make them more effective. We're going to, like you just saw, a biofiller presentation. Peptides can be used in the biofiller to enhance the effects, to make it more effective in terms of signaling the type of cell growth and production you want. You can use peptides for sleep promotion. You can use peptides to restore gut health. There are thousands of applications, really.